Hi, my name is Dr. Kimberley Bell. I'm a doctor of physical therapy, and I specialize in working with people who are suffering with dizziness, vertigo, imbalance, and unexplained repeated falls. Today we're going to answer a question that I frequently hear, which is, does everybody who's suffering with dizziness have mental health issues as well, such as anxiety or depression? The answer is that it's currently estimated by researchers that about 40% of people who have dizziness and vertigo are also suffering with some kind of mental health issue, such as anxiety or depression. In my practice, what I find is that the majority of patients who are suffering with dizziness and vertigo do have some level of anxiety regarding their condition. Now, whether the anxiety came first and the experiences of anxiety, panic attack, and hyperventilation are contributing to the symptoms of dizziness, or whether the dizziness and vertigo came first and the presence of dizziness and vertigo is causing symptoms of anxiety, that sometimes is difficult to determine. But when I work with one of my patients, I always address both their symptoms of anxiety as well as their symptoms of dizziness and vertigo. What I have found is that when I address both the physical and the mental health conditions that I find in people who are suffering, especially those who've been suffering for a long time, that the results are better, the healing is more deep and more complete. Sometimes people do need mental health support by a mental health professional, such as a psychologist or a psychiatrist or a marriage and family therapist, to provide them with the counseling and support that they need as they're going through the vestibular rehab. And that will allow them to have the best possible recovery that they can from their dizziness and vertigo. So if you're someone who is suffering with anxiety or depression, and you also have dizziness and vertigo, I highly recommend for you to seek out a vestibular specialist to evaluate the dizziness and vertigo at the Vestibular Disorders Association, and please consider seeking out professional mental health support if your symptoms of anxiety and depression are persistent. That will allow you to have the best possible recovery from your symptoms and to help you enjoy an improvement in your quality of life. Thank you for tuning in to today's Frequently Asked Question with Dr. Kimberley Bell. Please visit my website, betterbalanceinlife.com, for more information.